The Trump administration reportedly planning to raise concerns today that pregnant women's use of the active ingredient in Tylenol may be linked to autism. Shares of Tylenol maker Kenvue are lower. The Washington Post says that federal health officials are expected to warn women against using acetaminophen early in pregnancy unless they have a fever. It also says officials will highlight a drug that's similar to folate as a potential autism treatment. Joining us with more on this right now is Dr. Scott Gottlieb. He's the former FDA commissioner under the first Trump administration, also a CNBC contributor, and he serves on the boards of both Illumina and Pfizer. And Scott, what do you think about this?
Well, look, I think the science is really unsettled. The data around felinic acid and autism is interesting. It's mostly small studies. If you look at the studies that have been done, they either have 50 to 100 patients in them where they do show an improvement with the administration of that compound. This is a metabolically active form of folate, the vitamin B9. It's used in medicine in treatment of certain cancer patients who are on methotrexate, or patients with autoimmune disease who are also taking methotrexate, also certain forms of anemia. There's been some small studies showing an improvement in verbal language skills in patients treated who have autism with felinic acid. Certainly worthy of further exploration. I know the FDA is considering some label updates with respect to this. I think it's going to take larger randomized trials to really prove out whether there's a correlation between the drug
and an
improvement. Are there side effects
if you start taking this immediately without?
Minimal. I mean, there are gastrointestinal side effects. The doses that we use in cancer patients or patients who are with autoimmune diseases who take methotrexate are much higher. So the dose that would be prescribed in a setting of autism is about 50 milligrams a day, split between 2 doses. So it's a much lower dose. So it's a generally safe drug. And if you look at the studies that have been done, most of the benefit that people believe they're observing is in early administration of the drug. So it's the kind of thing where you could give someone a trial of it and see if there's some symptom improvement, particularly with language skills. I don't think you should go out and use it right now based on the body of evidence that exists, but it's certainly worthy of further exploration.
Let's get to the controversial stuff. Does Tylenol cause autism?
Well, look, this has been extensively studied. There was a study in JAMA in 2024 with 2.48 million siblings, showed no correlation. There's been some smaller studies suggesting that there could be a correlation. Again, worthy of further study, but there is no clear evidence that it causes autism for women who take it during pregnancy. And if you look at utilization rates in pregnancy of Tylenol over the last 20 years, it's gone down. So there was about 70% utilization of Tylenol in pregnancy, any administration, so people who might have only used it a few times. Now it's about 60%, and over that time period, autism rates have gone up, not down. So it doesn't suggest there's a correlation.
Scott, what's the percentage of people with autism that have gut issues, and is it usually the more serious cases, the less, I mean, you can have high function. I mean, the spectrum is so wide, it's amazing, but there are gut issues, and is that some type of correlation between autoimmune factors, and those could be involved in causing autism early on, and they just happen to cause gut issues at the same time? Or?
Yeah, well, this is some of the speculation around the use of felinic acid, which is metabolically active form of folate. Yeah. So the speculation is that people with autism have autoantibodies against the folate receptor, so they can't bring folate into the brain because you're basically attacking the receptors where it would bind. So by giving this metabolically active form, it more easily penetrates the brain. That's why you see symptom improvement. So there is a constellation of symptoms that some of autism, some elements of it are believed to be related to autoimmune phenomena, and that partially explains some of the observed GI effects. But it's a constellation of symptoms, as you said. So there is no one clear definition of what constitutes autism.
The president, the MTHFR gene, is that specifically what it's linked to? Because that's the gene that doesn't take folate.
Some speculation, yeah.
The president used some numbers yesterday that weren't. Is it boys in New Jersey 1 out of 40 or something like? I mean,
yeah, about that.
It's not 1 out of 10 or 12. I don't know.
I've seen 1 out of 31.
I saw 1 out of 31.
Clearly, an element.
1 out of 31 is a lot. And what I asked you off camera was, the lion's share is probably diagnosis.
That's right.
But the lion's share is, what's that? 50, it could be as low as 51%. 49% could be something different than what was done in the past. Is that fair?
I don't know how to break it apart. It's hard to tease apart.
All right, but clearly, there is some contribution from something that we have.
It seems that there's some contribution from something that's not just people having children at an older age or overdiagnosis.
But that's part of it, probably, too, don't you think?
That is
older fathers or older mothers or both?
They say fathers.
Here's the thing that kind of, if I were a pregnant woman today, I would be so confused as to what to do, because there's also high risk if you have a fever and you don't treat the fever. There's high risk to the baby at that point, too.
High risk from an untreated fever, high risk from untreated pain. You can't use NSAIDs in pregnancy. There is a much clearer correlation between NSAID use and miscarriage and birth defects. So this doesn't leave women a lot of good options. I think it's going to create more confusion in the marketplace.
That's my concern with
Medical
this.
societies are still recommending, notwithstanding what's likely to be pronounced today, that women continue to use Tylenol in pregnancy. So people have to consult their provider and use it appropriately. You know, there is a general recommendation that you use it as infrequently as possible,
Sure.
any medicine during pregnancy.
But if you go to the point where you say, I can't use this, and look, you think about the things that pregnant women are told. Forget about alcohol and cigarettes, the very obvious ones. You can't eat deli meat. You can't eat sushi. You shouldn't be coloring your hair. Don't do caffeine. Don't drink out of plastic. You know, run down the list of everything you're not supposed to do. And you worry about how they take and interpret all of that. And then if something does happen, they assume it's their fault for what they do.
Yeah, look, and you also have to parse these things. So the deli meat's related to listeria. So
Right.
if you're sourcing it from places where you think it's cut more safely, it's safe. So you have to parse this as well. But you're right, there's a lot of difficult guidance. It's difficult to be a pregnant mom right now with all the various guidance and, you know, the perceived restrictions on what you can and can't do. This is going to add to that for sure. I think it's going to lead a lot of people to call their physician.